So why does the flexion occur in sagittal plane? Why the extension happens in transverse plane? And why there is a movement that occurs around the axis. Axis and planes are the very basic and very main topics that covers the whole medical fields. These both terms are imaginary and are designed particularly by anatomists to understand the basic movement. So today we are going to mug up the anatomy and understand fully and deeply what these two terms are. The human body is a three-dimensional. Our movement doesn't happen randomly. They occur in specific direction and specific light. To understand this movement scientifically, anatomists imagine a flat surface. Planes are like a imaginary glass sheets cutting the body. And axes are the imaginary line in which our bodies rotate. The surface part is planes. The imaginary rod thing is axis. Planes, in simple language, are the direction of movement, whereas axis is, in general, is an imaginary rotation. The body part also rotates around the imaginary line. In simple language, axis is called as a rotation. The golden rule to understand axis and plane is the movement occur in a plane and around an axis is perpendicular to that plane. And before understanding axis and plane, you have to know about anatomical position. So anatomical position means standing straight, head up and forwards, palms facing forwards and toes also face forward, straight, and the lower limb and upper limb are parallel to each other is our anatomical position. The type of plane. First plane is sagittal plane. So let's talk about sagittal plane. Sagittal plane is a plane which divides our body. Right and left is our sagittal plane. If the division occur exactly in the median plane, is called as mid-sagittal or median plane. So sagittal plane is any plane that divides our body. As for understanding, we can say it is a glass sheet, imaginary glass sheet, which is dividing our body in right and left is our sagittal. And if we talk about mid-sagittal, division occur exactly in the center of the body, which dividing equal right and equal left is our mid-sagittal or median plane. Example of sagittal plane is elbow flexion, knee flexion, forward bending. The mnemonic for to understand sagittal plane is the side view. The side view, the flexion of elbow, the flexion of knee, and the side bends. This is easy to look these movement from side, not when we are facing forward. So now let's talk about the second plane, which is our frontal plane. Frontal plane is also called as coronal plane. For example, the glass sheet dividing the body in front and back is our frontal plane. Or we can say in anterior and posterior is our frontal or coronal plane. Example of frontal plane is abduction of shoulder and abduction of hip. And mnemonic for the frontal plane is front view. Front means when we all are viewing this movement, these both movement clearly in front view, frontal plane. That's why now the third plane, transverse plane or horizontal plane. When our body is divided into upper and lower part is called as transverse plane. Movement occur in transverse plane is neck rotation, supination and pronation or trans movement. Upper section and lower section. In simple, transverse means turning. Now let's talk about oblique plane. Oblique means diagonal. Any plane that divides the body diagonally, like in an angle particularly, is an oblique plane. This plane is usually helpful in CT, MRI. The patient position is slightly slanting or tilted. So now let's talk about axis. We have three types of axis in general. Like first is our sagittal axis. Second is our frontal axis. And third is our vertical axis. So now let's talk about axis in simple is an imaginary line that rotates or spin the body around its movement. So let's talk about sagittal axis first. Sagittal axis, for example, we can say The arrow is hitting the body straight through the belly from front to the back. Our frontal axis, or we can say a coronal axis. This axis run side to side, like a stick or an arrow hitting from our elbow to this elbow. And third and last, we have our vertical axis. Vertical axis run from the top to the bottom. Is our vertical axis from head to toe. Straight passing line is our vertical axis. So these axes and planes are not just anatomy part, they are the foundation of a biomechanics and movement science. Once you start visualizing in 3 dimensions, anatomy is much more to understand.